I want to ask you a very simple question, one that most of my patients over 60 have never really been asked seriously. When was the last time you felt your body getting weaker? Not sharp pain, not a hospital visit, just small things. You get tired faster when you walk. You hesitate to carry a grocery bag that used to feel light. You take a few extra seconds to stand up from a chair. So many people say to me, "Doctor, I guess that's just what getting old feels like." But after more than 30 years working with older adults, I've learned something important. The body almost never gets weak all at once. It declines slowly, quietly. And the most dangerous part isn't the discomfort. It's the way we adapt the wrong way. We change our lives to avoid weakness instead of recognizing that weakness is often a warning about our heart, our muscles, and our ability to live independently. My name is David Warren. I'm a physician who specializes in senior health, and I'm 60 years old myself. And trust me, I'm not sharing this from a textbook. I'm sharing it from what I see every single day in my clinic. I see patients who look fine on the outside. Their lab results aren't terrible, but the moment I ask them to perform one very basic movement, everything becomes clear. Their breathing speeds up. Their body loses control. And there's that look of surprise, because they didn't realize how weak they'd become. The truth is, after 50 or 60, functional strength becomes the most important measure of health, not your weight, not your age. But this simple question, is your body still strong enough to support your everyday life? The good news is this: you don't need expensive machines. You don't need a lab. You don't even need to come into my office to start understanding where you really stand. In this video, I'm going to share a very simple 1-minute test you can do at home. This test isn't about proving you're good or bad. It's about answering one important question. Where are my heart and muscles on the aging journey? And even more important, if you don't like your result, you can improve it no matter your age. 1. Why a simple movement can reveal the biological age of your heart and muscles. In geriatric medicine, we use a concept that most people outside healthcare rarely hear about: biological age. Two people can both be 65 years old, the same height, the same weight, but one walks upstairs easily, breathing steady. The other has to stop halfway, heart racing, legs shaking. On paper, they're the same age. Inside their bodies, they're aging very differently. That difference isn't luck. It comes down to how well the heart, muscles, nerves, and lungs work together. When you perform a movement that challenges your own body weight, even briefly, your body has to activate large muscles in the arms, shoulders, and chest, stabilize the torso with core muscles, increase heart rate to deliver oxygen, coordinate breathing with movement. In other words, multiple systems have to communicate at the same time. After 60, what concerns us isn't one weak muscle. It's a breakdown in full body coordination. When the heart doesn't respond efficiently, when muscles lose endurance, when nerve signals slow down, the body tries to conserve energy by doing one thing: it avoids movement. And that's how the downward spiral begins. Less movement, faster weakness, more weakness, fear of movement, loss of independence. What I appreciate about short functional tests is that they don't give the body time to hide the truth. In just a brief moment, you can see clearly how resilient your heart really is, whether your muscles still tolerate stress, and most importantly, whether you're aging faster or slower than your calendar age. I often tell my patients, the body doesn't lie. We just rarely ask the right questions. Real benefits for adults over 60. Spot early strength decline, act before joint pain, severe fatigue, or medications become necessary. Have a clear baseline to track progress over time. My personal advice: don't use the result to criticize yourself. Use it like a fuel gauge before a long drive. Knowing where you are is always better than driving blind. 2. Your number isn't a label, it's a medical signal. When it comes to physical tests, my biggest concern isn't that older adults perform poorly, it's that they misunderstand the result. I see patients look at one number and immediately say, "I'm weak. It's too late for me. This kind of exercise just isn't for me." But in medicine, numbers are never judgments. They're information. And good information leads to good decisions. When you complete a short body weight test, we're not interested in how you compare to others. We're looking at how long your muscles tolerate load, how your heart responds to increased oxygen demand, whether your nervous system still coordinates movement smoothly. If your result is low, that doesn't mean you failed. It means something very specific. Your body needs to be rebuilt, starting from the foundation. People in the middle range often fall into a silent risk zone. They can do daily tasks, so they assume everything is fine. But one illness, one fall, or a few inactive months can cause strength to drop rapidly. Those with higher results often have an advantage they don't realize: biological reserve. That means when life throws challenges, surgery, illness, prolonged stress, their bodies still have room to recover. I once told a 72-year-old patient, "Today's result isn't something to be proud or ashamed of. It's a map for the next 5 to 10 years. Benefits of understanding your number correctly. You know whether to rebuild or maintain. You avoid overtraining or quitting too soon. You train with purpose instead of guesswork. The right mindset after 60, compare yourself to who you'll be in 30 days, not to others. Write results down like blood pressure or blood sugar. Focus on trends, not starting points. My personal advice: if today you could only do a little, remember this. Every strong, healthy body I've seen in my clinic started from a weaker place than where it ended up." 3. The hidden switches that explain why some people keep exercising but still don't get stronger. In my clinic, there's one line I hear over and over: "Doctor, I'm still moving around, so why do I feel weaker?" That question matters more than you think, because after 60, exercise is only a small piece of the health picture. The rest comes down to what most people don't pay attention to, what I call the hidden switches. The first switch is nutrition, especially protein. When we're younger, our bodies use protein pretty efficiently. But as we get older, that efficiency drops a lot. So what happens is, you eat the same way, you still lose muscle, you train the same way. You don't recover the same way. I usually explain it like this. An older muscle is like an older home. If you want to renovate it, you need more materials, and you need the right kind. If your meals don't include enough high-quality protein, your body simply doesn't have enough building blocks to repair muscle after activity, even if you're working hard. The second switch is sleep. A lot of people treat poor sleep like it's normal. But after 60, poor sleep basically means poor recovery. During deep sleep, your body releases hormones that help rebuild muscle tissue, strengthen bones, stabilize the cardiovascular system. Chronic sleep loss is like trying to build a house, but only working during the day and never doing the repairs at night. The third switch is rest time. Muscle doesn't get stronger because you push harder every single day. It gets stronger when you train well, and then give the body time to adapt. For adults over 60, training hard non-stop often leads to joint pain, lingering fatigue, and eventually quitting. The fourth switch is technique. Doing the movement the wrong way isn't just less effective. It can trick you. You feel like you're getting stronger, but really you're just finding ways to cheat the motion to avoid the weak spot. Real-life benefits when you fix these switches. Strength comes back faster, even with less training, fewer random aches, less unexplained fatigue. You actually feel your body respond within a few weeks. My personal advice: if you're feeling weak, don't rush to train harder. Ask yourself, am I eating enough for my body to rebuild? Am I sleeping enough to recover? Am I giving myself enough rest time? Sometimes getting stronger starts with stopping the constant pressure and letting your body finally recover. 4. If your number is very low, how to rebuild strength without getting injured. I want you to hear this clearly first. Starting weak is not the problem. Starting the wrong way is the problem. A lot of people over 60 try to get back into exercise, and they quit after a few weeks. Not because they're lazy, but because they start at a level that doesn't match their current body. Here's the truth about the body after 60. It can still adapt, but it needs a clear, gentle signal. Instead of asking, "How much can I do?" I coach my patients to ask, "What can I do today that I'll still feel okay doing tomorrow?" The first principle is reduce the load, not the value. A lighter version of a movement, done correctly, still sends a powerful signal to your muscles, your heart, your nervous system. Your body doesn't care if the workout looks impressive. It only cares whether the stress is the right amount for adaptation. That's why for people starting very low, I recommend beginning with joint-friendly versions. Not to go easy, but to rebuild trust in your body, restore control of the movement, avoid that fear of pain reflex. When you do a movement in a safe position, you're teaching your brain, this movement isn't dangerous. And when the brain relaxes, the body cooperates. The second principle is steady accumulation, not forcing it. At this age, progress rarely comes from one hard workout. It comes from small, consistent repetitions over time. I've seen patients who only train a few minutes at a time, but they do it almost every day. And a few months later, their strength is noticeably better, without pain, without injury. The third principle is respect your recovery rhythm. Feeling a little sore doesn't automatically mean something is wrong. But if you're exhausted for days, sleeping worse, or getting a constant dull ache, that's a sign to back off. Real-life benefits of this approach: lower risk of shoulder, back, and knee pain. You feel like I'm in control of my body again. You stay motivated long-term instead of quitting halfway. My personal advice, if you're starting from a very low point, think of it like an empty foundation. Building on a clean foundation is always easier than trying to repair a cracked one. 5. How to test yourself safely at home and turn your result into a long-term tracking tool. What worries me most isn't older adults testing their strength. It's doing it without understanding the real purpose. A good test isn't meant to push you to the edge. It's meant to give you a quick snapshot of where your body is right now. Before you start, I remind patients of 3 simple things. First, safety matters more than the number. If you feel sharp pain in the shoulder, back or chest dizziness, or unusual shortness of breath, or you lose control of the movement, stop immediately. Your body doesn't earn points for pushing through warning signs. Second, choose the version that fits you. There isn't one single version for everyone. You can start with an easier level as long as you keep your body stable, move with control, and don't cheat by cutting the range of motion. The version you choose today isn't your ceiling, it's simply your starting line. Third, speed matters less than breathing. Slow, steady movement with calm breathing often gives a much more accurate picture of heart and muscle function than fast reps with sloppy control. After you finish, write your result down. Don't just try to remember it. Writing it down helps you see a trend, not just a moment. I tell patients to treat it like a blood pressure reading or a blood sugar number. It only becomes meaningful when you track it over time. Retest in about a month under similar conditions, same time of day, same version of the movement, same counting method. If the number goes up, even a little, that's a great sign. It means your body's responding. If it doesn't change yet, don't get discouraged. Look at your sleep, your nutrition, how often you're resting. Sometimes the issue isn't the exercise itself. It's what's happening between workouts. Benefits of tracking the right way. You notice progress early. More motivation, you catch plateaus and adjust in time. You avoid training blindly or pushing too hard. My personal advice, if you remember only one thing from this section, remember this. You don't need to get strong in one day. You just need to know you're moving in the right direction. Closing. Before we wrap up, I want you to pause for a second and think about this. The strength we talked about today isn't for showing off. It's not for comparing yourself to anyone else. And it's definitely not meant to pressure you. It serves one simple purpose: to make your life easier. Easier to stand up from a chair. Easier to carry things. Easier to play with your grandkids. Easier to travel. Easier to take care of yourself without relying on others. After 60, the most valuable thing isn't athletic performance, it's independence. This short test is just a small tool, but sometimes a small tool helps you see a very big picture. Is your heart still responding well? Is your body still coordinating smoothly? And most importantly, are you steering your health or just letting time take over? I've met plenty of people in their 70s, even their 80s, whose functional strength surprised people decades younger. Not because they got lucky, but because they didn't ignore the small signals when their bodies began to change. If today your result wasn't what you hoped for, don't be discouraged. That doesn't mean you're bad. It means you recognize the right time to start. And if your result is pretty good, take it as a reminder to keep maintaining it. Because strength is like savings. It only matters if you keep it. If you found this helpful, you can subscribe to the channel so we can keep working together in the next videos. We don't chase trends here. We don't do extreme workouts. We focus on what actually helps adults over 50 and 60 stay healthy, steady, and confident day by day. And before you go, one important reminder. This video is for education and general information only. It does not replace medical advice, diagnosis, or treatment. If you have underlying health conditions, unusual symptoms, or concerns about your heart, please talk with your healthcare provider before trying anything new. Thank you for taking time for your health. That's always the right decision.